Rahim. Assalamu alaikum. Welcome to this new video on Omicron new variant BA.2.75. It's nicknamed as Centaurus, which is basically half horse and half man, mythological imaginary picture in the Greek mythology. So today we will talk about the new variant because we have already talked about the BA4, BA5, and this is a new variant reported in early May in India, and now it has spread to 10 countries, which include UK, USA, Israel, Canada, Netherlands, Australia, Germany. So these are the countries. They are reporting this new variant, and sequencing is going on, and the changes in this new variant Centaurus are reported on the spike protein receptor binding domain, and at least 9 spike protein variation or changes are reported in the sequence, and they are named as G446S, and other variants are also seen in certain sequencing. As per this mutation, this new variant can be more serious and more affecting the immunity, because the infection is in the already infected COVID patients as well as the vaccinated group or cohort of the people, and so this gives us some kind of difficulty to understand that whether these variations, these changes, these mutation will make the program of vaccination ineffective at the end, or this is just a normal variant which will become a friendly variant over the course of time. In India, the BA5, which is more prevalent in USA, UK, causing many diseases and hospitalization. This is BA1 is also a part of the Omicron, and COVID-19 started from the Wuhan, China in 2019, end of the December, and then it spread, and we had alpha, beta, gamma, and then Omicron variants, and now the Omicron is giving us new sub-variants, BA1, BA2, BA4, BA5, and latest in the row is BA.2.75. Why it has originated from the India is still a big question, and why it is spreading at least in the 10 countries with a fast speed. Even vaccinated people are infected. The already infected people are also showing the infection of the Centaurus or BA.2.75. So virologists and the public health specialists are considering this as a new emergency, or it may change the course of the pandemic over the time, and we can have a serious wave of this new variant. So in Pakistan we have already BA4, BA5, and if this variant, because India is our neighboring country, and we must be vigilant on these SOPs, vaccination, booster dose. In Pakistan, the election campaigns are going on. The rain is also affecting many people, as well as we have other such situations of the climate and social movements in Pakistan. So anyway, the SOPs, which include hand washing, mask using or wearing the mask, social distance, as well as the boosting of immunity, keeping yourself fit according to the climate changes or climate situations, having a proper rest as well as a balanced diet or a good diet. The schools, the factories, the agriculture sector, and even the social life depends how we deal with the new variant Centaurus. And if it reaches to Pakistan, we must have uh, control over the entry points, whether they are air, sea, or land routes. So I will request to the Sindh government, to the health department, that the SOPs and the task force or the NCOC and NIH should have a daily reporting on the Centaurus and new variants, so that the community can understand and take proper measures. As from the ISRA University, as I am focal person of the COVID affairs, so we have till date administered about 100,000 doses to the students, faculty, and the local community. And this center is one of the leading center and properly managed center. But in Hyderabad already vaccination program by the health department is very successful. So I once again request to the community that they should not forget that COVID is still in Pakistan, new variants are still in Pakistan. The rural people, the rural population, they should take notice of this new variant and the new waves which may occur or have been occurring as BA.4, BA.5 have caused 10 deaths few days ago. That is one of the major concern, because in Pakistan the death rate was either 0 or 1 or 2 people were succumbed to the COVID vaccine, but 10 deaths in one a day is a big figure. So far, Pakistan has vaccinated 61% of its population, and fully vaccinated is 55%. So I will request that you should approach for the booster dose if 6 months have been the duration of the last dose given to you. And the health worker, the immunocompromised people, the elderly people, they should get the second dose also, so that we can have a better immunity. Once again, Dr. Hussain Bashkolachi YouTube channel will give you the latest information on the COVID and other interesting topics of community medicine and public health. Please do comment, and your views, your sharing of this YouTube channel, as well as if you have not subscribed, then subscribe this channel, so that you can have updated and latest information in the context of Pakistan and province of Sindh. Thank you very much.